Okay, welcome everyone one more time to the Genius class. So today we're going to be looking at a few scenarios. Let's start with meningitis. So I'm going to share the screen. Okay, so our next task is meningitis. Now, in this particular case, you're in FY2 in a GP surgery. Here, you're in FY2 in a GP surgery. A 30-year-old gentleman has presented with some concerns. The opening sentence of this particular gentleman is, "Doctor, I've got a little bit of a fever, and I have a little bit of a headache. I've got a fever, doctor, and a little bit of a headache. I just feel hot all the time." Now, this particular patient will stress on the fever and minimize the headache. So if you're not careful, you will actually neglect the history of the headache. When you ask about the fever, just going to tell you, "Doctor, I feel hot all the time." He recently returned from Kenya, that is 2 days ago. Okay, and he returned from Kenya with a fever. He also has got photophobia, that is shying away from light, and he has got pain in the neck, which is neck stiffness. When you ask about the character of his fever, in terms of whether there's a particular time of the day he's experiencing the temperature, he will tell you it is all the time. Constantly, "I've got a fever, I feel hot all the time." Now, this is crucial to differentiate from malaria because of the history of traveling, where, of course, malaria will occur, maybe every 72 hours, okay, and in particular time of the day, maybe in the evenings. Here, there is no pattern, it's a constant fever. So what will be on our approach in this particular task? Okay, first, the history of presenting complaint. As I said, the presenting complaint is a fever, but if you take the history properly, what you're going to be finding in here, that there is a fever, he also has got a headache, he has got photophobia, and you have to use the body language of the patient. You look at the body language, you comment at their body language. You can see that he's shying away from light. The light is hitting his eyes, of course. You'll be looking down as if he's trying to close the eyes because there's light in the room. Okay, so it's important to ask for other symptoms other than fever, the headache, malaise, okay, any other symptoms the patient has. Do not focus only on one symptom, or you may make a wrong diagnosis. Then the differential diagnosis, you have to consider what could be the DDs. The travel history in this particular patient increases the differential diagnosis. Then after the DDs, we take the rest of the history as usual, the PMAF-TOSA, the travel history, the ICE, the effects of symptoms, and to summarize. In particular, the differential diagnosis to consider is the things that causes fever, UTI, meningitis, pneumonia, sore throat. It's important to do a systemic review to find out, because the fever is non-specific. Where is the source of an infection? A systemic review is important, and that will help you to pick up a meningitis. Malaria, because of the travel history. So if you want to exclude malaria, then you're going to be asking about taking prophylaxis before going. This particular patient he didn't take, okay? And whether he was bitten by mosquitoes there, or whether he protected himself from the mosquitoes. So we're going to be asking all those history. And where did he go? How long did he stay there for? Okay, how long was he there? Yeah, good. So the differential diagnosis here has to be good. Then you have to mention examination from the history, suspecting that, of course, there is a fever, so you need observations. You're going to find there is a temperature of 80 degrees. Now, when you see that there is a meningitis, neck stiffness, headache, and fever, you should suspect meningitis. You need a neurological examination. That should include Kenning sign, Brzezinski sign, examination of the lower limb and the upper limb as well. Okay, lower limb and upper limb examinations. A fundoscopy is important in meningitis. Okay, now when you mention that you want to perform examination, now what also here we need, I'm going to go back one slide. We need head to toe. Why? Because we're going to be looking for rashes. Now, when you say head to toe, to avoid being robotic, you need to say what you're looking for, yeah? So we're going to be doing head to toe examination to look for any rashes on the body. Good. Then they're going to give you a picture of a rash. As you can see, there's some rashes on the thigh. So you see the rash in here, then you have to do what? A tumbler test. Is this a blanching rash or non-blanching rash? So we're doing a tumbler test where you take a glass, you press on the rash to see whether it is blanching or it's not blanching. Okay. Now, of course, they'll tell you it's non-blanching rash. Then diagnosis is meningitis. You have to explain to the patient you're suspecting meningitis. It's an infection of the coverings of the brain. Okay, good. So what you're going to have to do in here, now pay attention, our management to this particular patient is in GP surgery. Okay, because it's in GP surgery, we have to refer to hospital for assessment and treatment. Agent, refer to hospital. We're going to be calling an ambulance. Call an ambulance for patient to go to hospital. Before you go to hospital, because if you're in a GP, what you're going to do, we're going to give benzylpenicillin, IV or IM. Yeah, so one sentence in here, benzylpenicillin, IM or IV, and then send the patient to hospital. So this we're going to give in GP. Benzylpenicillin in GP. Yeah, we call an ambulance and agent to transfer the patient to hospital. Then we have to explain to the patient what will happen in hospital. They're going to give IV fluids, of course. There is a rash. We're suspecting is a meningococcus septicemia. Our diagnosis meningitis, in particular, meningococcus septicemia, is a potentially life-threatening condition. When you go to hospital, they'll give you some IV fluids, okay? Because the blood pressure may drop. They'll monitor your blood pressure, your pulse, okay? They may give you intravenous antibiotics when you're in hospital. So when they're in hospital, we give you different antibiotics. Which one? The ceftriaxone, okay? What else they can do in hospital? CT scan of the head. A lumbar puncture. This is a diagnostic investigation where they take some fluids from your spine. Yeah, they put a needle on your back, take some fluid from your spine to confirm whether you've got a meningitis or not. Okay. Then routine investigation. Yeah. Now I'm going to change. Routine investigation is a full blood count. I like a full, not a C. Yeah. So a full blood count is written in an American way. Let's change to the British way. Okay. Liver function test. U1 is glucose. Okay. Plus, of course, we said already they're going to treat antibiotics, intravenous fluid, close monitoring. We have mentioned this particular part. Okay. And we mentioned the CT head, lumbar puncture. That would also already be mentioned, would be done. Routine investigation as usual will be done. So this particular part in here, we do not need. Yeah. So let's recap the management. Arrange transfer to hospital. Call an ambulance. Okay. Give benzylpenicillin while in a GP. IM or IV. Explain to the patient what will happen in the hospital. Okay, what's going to happen in the hospital. Before then, he has got a headache. We can give paracetamol. Yeah, we can give paracetamol to the patient for the headache. Then explain what will happen. They'll give him IV fluids. They'll monitor him closely, the blood pressure, the pulse. They'll give IV antibiotics in hospital, which is slightly different to the one you're going to give it in a GP surgery. Okay, and then importantly, what else they might do. Okay. I think I remove one point in here. They might do, remember we said, they might do a CT scan of the head. Yeah. Always when we speak, we say this is what it might happen in hospital. So what might happen in hospital, they may perform a scan of the head, a CT scan. They may perform a lumbar puncture, put a needle on the back, on your back into your spine to take some fluid and to assess it, of course, for meningitis. That's a diagnostic investigation. They also perform a routine investigation. When you go to hospital, they will perform routine investigations, such as full blood count. Okay, what is full blood count in layman's term? Blood test to check that you're not anemic. Blood test to check how your kidneys and liver are working. This is twice, so remove. Blood test to check how your kidneys and liver are working. Okay, check your glucose, your tendency to form clot or to bleed. That's clotting screen. Okay, we have to check the CRP, the signs of infection in your body. We're going to do these ones as well. Okay, so make sure the patient understands what will happen when they go to hospital. Okay, thank you.